hey, what about this? Or how did you come up with that? Or, I think that they said something about research in Massachusetts. Well, this is Massachusetts, it's like.
Every state's different.
Right, and where you start looking at the condensing, Louisville's going to be different from Marion. So it's
There's one district out the difference what it is. I think that's what it is.
already.
Jefferson County is on there?
Okay, we are live and ready. And it is 6:30, so I'm going to go ahead and call this meeting to order. The first item on, and we've got an ARP ESSER funding discussion.
Good evening, everybody. All right, you should have received, or it was attached, the funding narrative, but I wanted to ask you before we got into that, if you wanted an overview of ESSER 1 and 2. I did not attach that, but we can talk about that, so take one of those. I thought it would be maybe pertinent to let you look at the whole picture before we got into 3. All right. So this is just kind of a one-pager, and what I hope to do for you is just kind of give you that bird's eye view of what all this funding is looking for, because as we talked about last time, there's names, so many dates. So what you'll see in that first column is what the grant name is, and then I also put when that money must be spent by, because each one has a different year. The second column has your amount, and then the third column has just an overview. It's not every single purchase, but it's kind of, if you had to say what were we spending it on, this is what right now Marion County has spent on. And then I did give a remaining total. It's not to the penny, but kind of gives us a gist to look at. So if we go to the top one, ESSER's 1, or what was called the CARES Act, we did get $762,385. The PS underneath that is the private school portion that came out. And that was the part that actually they kind of messed up on at the beginning, where we were giving them a lot more money than they were allocated, but then they readjusted. So you may see some communication where that number looked a bit larger in the beginning, but then they adjusted it. But we're confident that that was that number. And we did actually, they did purchase more than some of those numbers, but some of it is technology and things, and we will just get that back when all this is kind of done and over. But so what you can see is a lot of our ESSER's 1 money was spent on that PPE, these masks, the wands that we have, the disinfectants, the sanitizer. I should have let Tim talk about this one. He had mountains of things in his office. We did put the virtual teacher in there that we got near the end of that year. We purchased some supplemental curriculum when we were going virtual quickly. So we purchased a year's worth of that. We did a lot of COVID supplies and signage, all the stuff that went on the floors, posters. We purchased a poster maker to make our own so we could have some in-house. We did, out of CARES, also get some new laptops, Chromebooks, because some of the computer things were outdated, and to run some of the software and the programs, we needed some updated. We did have some online professional learning. And then we did purchase some supplies for what came out of 2, which is Miss Ruth Ann. Welcome back, Miss Ruth Ann. She's
Minimal supplies.
Yeah, minimal supplies, but she is housed in my office, and I did not make her do a carry cart. Okay, so that was the CARES money. We still have about 180,000 remaining in there, and we have. Right now, are thinking, especially with Delta, we probably just going to keep that there for the COVID stuff. We just don't know. We just still have a lot of masks and things, but we just don't know where that goes. So we're going to keep that money there to spend on anything COVID anything like that related, but we'll relook at that as that date comes up. The Gears money that we got was about 130,000. Private school got 1,700 about. We spent all of that on technology needs because we replaced Chromebooks, bought new Chromebooks so that the next year we would have Chromebooks, so we have zero money left in the Gears. So then when I last talked to you, the next pot of money we got was the Sr2 money, and that's where we had the discussion about spending 85% on direct student services, 15% on non-direct. In that pot of money, we got 3.25 million about. And then I'll just jump down to that next thing just to let you know, we got approved. So those things that we did get that additional money. So that's where you'll see that 215,000. That's what it actually came out to. We projecting about 211. So they said we did a good job on the 8515, so they allowed us to get that extra money. So back up to the Sr2 and the 85, you'll see kind of the list there. Again, we kept virtual teachers. If we need some other kind of staffing, there's some money in there. But we did purchase out of Sr2 3-year contracts for all of the schools on some of these programs that they've been year to year. Maybe I'll get it this year, maybe I don't have it, but the other elementaries have it. So now we have 3-year contracts and now those are all programs like Lexia and Zern and Achieve, and iReady is the new taking place with MAP. So we felt like it was really important for teachers in this uncertain time that they know that next year and the year after, it's the same. You still get to use it instead of saying, well, I have this next year. And those are things that the students use as well. So we felt like, and especially if you go from one school to the next in the middle of the year, it's nice if you have the same programs. And so we decided with that large amount of money, getting that 3-year contract, which was very expensive, but not really, just put all together at that one time, was much more beneficial for our students. We have increased our virtual curriculum, the Play-Doh that you may have heard about in the past. We increased that to include elementary now because the board approved for us to have a K-12 virtual online. Teachers actually got resources. So up top there, the 3-year supplemental curriculum, we also purchased things for the teachers to use, digital or in their classroom. And I've just listed a few of those, but this, say for Screencastify, for example, that allows a teacher to video themselves, and then they can use that and play it back and students gone, or they can put it on their playlist. Zoom, Tear Deck is kind of like a little mini interactive thing. So we got the teachers those, and Class Kit goes along with the Google Classroom. Nurses, we're going to pay for nurses out of Sr2, general liability, workman's comp. We had outside graduation. We took those costs out of there because that was a direct relation to what we started, but we really like outside graduation. When the board approved the $40 an hour and $20 an hour, all of that funding for those special learning camps in the summer, the 2 weeks in June, that came out of here. All the summer books that went home, the 3 books, the postage, all came from ESSERS because that was a larger amount. Title picked up the books. We do pay for Ms. Kokenauer, the part-time ESSER budget coordinator. She comes 2 days a week. We have some professional development that we are working with several people to help us as we move forward in our journey of virtual blended learning, all of that together. And then we are purchasing preschool that we moved to Calvary. As we know, preschool has certain requirements that they must meet, like playgrounds and some of the outside equipment. We did buy stuff for inside the classrooms. That's kind of preschool, but to make the building preschool compliant, yes, thank you. We are purchasing slabs, concrete, things like that. So, and we're paying for that out of ESSERS too. So the other ESSERS2 money, that extra 215, we put that in technology because we now have done a Chromebook rotation lower. So that 5th graders this year are getting new Chromebooks. So we feel like, because we were only 6 through 12, and Tim might be able to speak to this, but the 5th graders now are getting them, and then 8th graders. So there's another rotation. So we feel like we're going to need more money to replace, repair, or, you know, they become obsolete after so many years, and we want to make sure we're sustainable on that. So we've just left that. We haven't spent any of that, so it's all still there. So then it gets us to the last one, which is our ESSERS 3. There was, initially it said we were going to get 7.3 million, but that was taken back to 7 million because there was an error at the Department of Education, and they had not allocated enough for homeless and DJJ and things like that. So instead of taking it back out of 1 and 2, they just reduced 3 because nobody had necessarily used any 3 yet. So our actual allocation is 7 million. With ESSERS 3, there is a caveat that we must spend 20% on learning loss, and it has 80% we can spend on other, or there's 20 categories that they have identified that you can spend it on. But they're also, in ESSERS 3 is what they're calling a maintenance of equity piece. And it took Ruthann and I a lot of calls, a lot of searching to even, I don't think everybody knows exactly, but what we had to do was identify our highest priority schools based on poverty. For us, that came out as Lebanon Elementary and Glasscock Elementary. Now, Ruthann and I, when we were talking to multiple people, we were trying to figure out whether we had to spend that amount of more money on those 2 schools out of the ESSERS 3 money, or is it just based on school report card numbers of per pupil amount that comes from state and local, which got very confusing to a lot of us and people at KDE. But what we figured out, and we did get confirmation, is that as long as we spend out of general fund, you can chime in on that one.
The state, what our local property tax brings in, and see what we get from the state. As long as we continue to spend that in the same way, not move any teachers out, put them in ESSERS, we need to keep spending that on what we're spending now, the levels.
So if we do that, so if we were spending 1,200 per student prior to, we still need to spend that or more on those 2 schools. So that does free up our ESSERS 3 a bit more onto what we want to spend that on. That's where the narrative comes in. This narrative was a mandated piece, and it was part of what they're calling meaningful consultation. What you see in front of you is what we had to present to KDE by 7/31, and that's where thank you for those that did the survey. We used the survey as our tool to answer these questions. We did get this return from KDE with the caveat that we needed to explain more on how we reached out to multiple groups. So I think what happened is we knew what we did with the survey. We said we did a survey. We didn't explain enough of what we did. But we also, when we got that back, we sent it directly to the president of the NCAAP, the county judge. We sent it to specific people to make sure that they had a chance. But you are part of the equation that we had to ask. We had to ask unions or our Marion County Education Teachers Association, and that's why there was multiple things you could click on the survey. So when we look at the survey, I'll go over quickly and then if you have questions, but we were very happy that we got about 418 responses, which was only out there for about 2 weeks. So we were pretty happy. What we saw on here is nothing that I don't think any of us would be surprised at. People are kind of concerned about all different subjects, critical thinking, time management, social, emotional. And then also on page, we didn't number the pages, but we had to decide, and the 4 top responses that were mentioned the most for us was intervention, enrichment, curriculum, staffing, and then we had training and professional development, and then indoor air quality. Those were our top 6, but we had to identify those top 4. And then the last part of the narrative was the relevant citations, which was making sure that any of those programs we bought were research-based. So I kind of put as much as I could, like, this is why we picked this program, if you wanna, go see it. So ask me questions, ask us questions. If you have any other input that you would like us to add before we send back to KDE for another round of whatever, but we were pretty happy that we only got one comment. I'm pretty sure other people got lots of comments. We saw some other plans.
I have to.
Yes.
Internet, a lot of families out in rural do not have internet service or cannot afford internet service. Is there any way some of this could be used for giving internet service that way?
Yes, because in years one, you could do that, and that's really more, Tim might speak to exactly, but we can pay for that out of ESSER2, in that, and ESSER3, if that is a need, like hotspots or maintain, but I know that some of that it's not available in some areas, but, we do have some buses that have it, or having some parking lots that are available, so that is a,
Do we have a grant that was specifically for that? So anybody, is that time already passed?
but it can be picked up in ESSER1, any of the things that you've kind of done in the past, you can pick that back up. So if that was a need, we could.
I know the businesses are also helping in doing that also, so.
Yes, but that is a need, if that's a specific need per family, I know our Friskies are working with that, we would work with those families if that's something that they need.
Another question I had is, on the programs that were chosen. Will they still be, how do you say, how computers come and go so fast, they're out within a year or a month, or how long are these programs?
Well, all of these programs that we chose are very adaptive, which means a lot of them adapt to a student's specific skill at that moment. So if the student takes it now, it can either generate a pathway for them to go on to with their skill set, so they can move forward on theirs. Somebody else is on a different pathway, so it's not all just a one and done. Most of these have been around for quite a while, so and they are adapting to Kentucky standards as soon. They usually do it before we do it. They tell us we've changed the standard change, so now we've changed our curriculum. So I believe that all of these are sustainable for several years past, even the 3 that we have.
So they can be interchanged as far as upgrading and all.
Yes.
I guess a couple things. When we look at sort of the programs or the criteria, we talk about intervention, enrichment, curriculum. What are some things we have in mind? I know we've got programs and things like that, but what are some other things that we have in mind that we think that we can do to, accomplish these objectives?
Well, I think this year we are working with Megan Martin, who is the new, what they call her, the CRESA coordinator, which is all a COVID type. She's with CKEC. She's going to be working with Marion County on our multi-tier system of support. And what that does is to help identify where there are gaps, like maybe we have a tier 1 instruction problem, and maybe we need new textbooks. If that is so, then I think we can incorporate that into that. A lot of the things that we have purchased are really supplemental because, some of them are online, some of them are, adapted, or you can print some things out, but really providing the digital environment, whether you're in person or fully virtual. So I think that tier 1 instruction is going to be very key for us as we move forward, and she is going to help us and the schools specifically to identify, what is that need. So if there is something we're missing, are we too heavy on one area and not enough? But that will help. So. Yeah.
One other question we've got is, could any of this money be used for like salaries or payment of employees?
We do have, because staffing was one of our pieces in ESSER3, we we are probably, if the board is okay, and as we move forward, and what our plan was is to have a lump kind of sum of salary, not knowing exactly who that is, like say, for example, we decide we need a homebound teacher, just somebody that just does that, or a truancy, support person who can go help us. But we don't necessarily, I think, know, and since we have till 2024 to spend this money, that's the tricky part. But we probably are going to put a chunk of money in salary. So whatever that looks like, and as we update the board, and if we hear other things, I think Ruthann and I can, not knowing exactly, it's gonna be hard because I have to now budget this in 3 weeks. I have to put 7 million somewhere. So I think I will put some in staffing. And whether that could be, it also could be maybe we decide that we need an extra, gap closure teacher everywhere. Maybe that's something we decide after we see, but we do have a lot of interventionists already. So, that's kind of, well, we just need to see what that looks like. So, but there will be a section in 3 that deals with staffing, whatever that might be.
Guess I'll add to, probably can't say, we're gonna give an extra 1% or 2% to all staff, and let's pay for that, because that wouldn't meet the 20 kind of requirements and the maintenance of equity kind of thing.
And I would almost hesitate to do something with regard to staffing, that if we're under normal school operations and in the future when we are beyond this mess,
Yeah.
I would hesitate to do something with regard to staffing that we're gonna need to continue on after this money is gone. So staffing wise, I would want
This
to
is not
stick
infinite
to,
money, this is very
yeah.
finite time we're
I
dealing
think
with.
people think that we can pay for everything. So Ruthann and I keep hearing that. Yes, and that's why we don't want to lock ourselves in, but if we come to the conclusion that there is a need for a staff member to focus on something like that, we will have that flexibility, but yeah, we don't want to, you hate to give and then have to take away. I mean, 2024 sounds like a long time, but we don't know that it'll be here before.
Give and take away or give, and then it'd be something 3 years from now that the general
The
fund
general
will
fund has to
apply.
take up, right? Another question? I will share, I know that there was some discussion on Esther's paying for HVAC. That was one of the things we've been working tireless to try to figure that out. It does look like you could pay for some of that out of this. Be reminded, you must pay that higher rate.
Yeah, right, prevailing wage.
Prevailing wage, you must pay that, and then you're taking your pot, because I think when we looked at it, I think the 3 needs that we had were West Marion, Glasscock, and Marion County Middle, had some HVAC, because that is indoor air quality, that's why it counts in this, but I think those totals come up to about 5.5 million. To address that. So if you did that, you've taken your entire 80%, you're left with the 20% that must only be spent on learning loss. So I do want to, I want to be, clear that they said, okay, that's where we were getting into that, because it wasn't Glasscock and LES. We were like, does that, they said, but again, I'm only going to say I'm 95% sure that they wouldn't ask you all back for 5.5 million. So, I mean, but at this moment, they did say that could be done.
So when we was talking about the high school and updating their HVAC, we could have done a normal update, or we could have went on to this extra update, which was 250,000, I think, that also helped with CO2 emissions. Is it a case where you could do that with other schools where we're gonna update the HVAC anyway, but we're gonna go on and add that to that system?
I
So
think,
how would something like that?
I think when you mix 2 things, then the entire project would have to be that higher
Okay, so you
prevailing
have to
wage.
be
So
This
It's
is
either
its
one or-
own project.
Okay,
yeah, it would have to be its own
so it could be,
separate.
okay,
So I think we did talk to Randy about that, and his caution to us was that you can pull from those 2 different pools of money for one project. So we could have done that at the high school, but then the entire high school project has to be paid on the prevailing wage. So, you know, if we folded in, like if we've got renovation projects going at, say, West Marion, and we wanted to add the, you know, the additional air purification or air indoor quality on top of it, we can do that. But every worker on that entire project has to be paid at the prevailing wage. So that was Randy's caution.
One thing too that I realized that the facility plan that exists has those 3 buildings that she mentioned as a HVAC need, so that would already be done, which would be helpful to be doing in that direction.
What would you want to do with the cost of the HVAC for each?
So the total cost of Shelley looked that we've been working on this week is roughly 5.5 or so million. West Marion and Glasgow for about 1.75 each. This is estimated cost. That will be taking West Marion from to a geothermal system. Okay, what Marion Middle and Glasgow are already geothermal, and that will be replacing all of the exhaust fresh air system and all the individual water source heat pump units in each classroom or space, update and all that. So it would improve their quality. You would see some savings in the general fund because your energy savings will be a lot better, more efficient with. The middle school project, larger project, about a little $2 million, a little bit bigger building.
Would it be possible to do an energy savings performance bond and do this at the same time?
So there's some talk and speculation, and right now it's looking like a yes, that you could do that with some extra money through this, as long as it's directly impacting those students. You're meeting all the requirements that they're expected to do, maintenance of equity and all this, that you can do a performance contract, which gives you a little more say in the systems and stuff. If you put a bid and spec at, it's a little different. So if you get to drive home performance contract, which we did in 2015, I think it was. So there is some possibilities. We don't have a definite yes, but we think we can. So it's a push things.
Yeah, and I would have said to pass on those performance contracts because we did one in 2015. You know, you guys then at that point took care of a lot of the low hanging fruit, but there's still stuff out there that we could realize savings too. So, but I also know that, you know, West Marion's HVAC situation is pretty critical.
33 years old.
Yeah.
Yeah. Wow. Now the boiler and the chiller on the infrastructure side of things, you know, components being the overall. So you can imagine it won't against as long as these 2 tables, that's probably one of these tables. So there might be some manipulation and stuff like that. A lot more indoor air quality.
I was just want to say that I like a real emphasis not only on the mental health, but also looking at these gaps. And I know that the schools are going to come up with a plan, I'm sure, that's to really target those students and what they really need to do individually. And I'm going to be really interested to hear what they come up with, and that way that it kind of gives you a better idea, and that's a better idea of how to use the money. And I wouldn't mind having some additional help in the schools, not as full time, but maybe some taken in there to get smaller groups and to help target those students. The problem is finding the staff.
Yeah.
I mean, we have great ideas,
Yes.
but we also need to reach out and say, you know, retired teachers, you know, those working on that have can substitute or whatever. If we could get them in there, of course that causes a problem. We take our substitutes, so it's just kind of like a.
Those are substitutes, our ESS, we kind of, that's the thing, you're gonna, we have positions right now that are regular classroom positions we need to fill. So it's very hard for us to say, oh, let's get some more when we cannot fill what, you know, we need, you know, bare minimum. So, but I do think that's why just leaving a staffing portion, generic in the SR3 part to see where we may need to add with if and when we can, you know, find that. So that's what
We're just begging for help. So now's the time. If you feel that this is your calling, we
you. Yes. And we will evaluate the programs, close to the 2024, near that end where we have to spend that money at the teachers and, kind of do a survey, if you still like it, then we will run another 3 years to give them 3 more years and pay for it right at that time. So potentially they could have a 6-year span of that, but we don't want to do that. 3 years is a long time, but we feel like at least you can really evaluate and say whether you like it. Did it help the students? Did it get what we were asking it to do? Is it adaptive? So again, I think as a teacher and as a mom and dad, if you have the same program, sometimes it's just a consistent, and among schools too, every school, there were schools that didn't get to have a certain program, but we bought it for everybody. So, and that's all out of that $2 money. So, because we did want to give it back to the schools and the teachers. So, any other comments you have for us that we can write in our narrative, or do you feel good about this kind of where we're at?
I feel good about the narrative. My only question is on, it's important. I believe in gathering feedback and gathering input is critical. That being said, are we held to the results of the survey? Because on this, staffing is identified as number 1. Looks like on responses, but as you all pointed out, it would be great to put in staffing. There are a couple of things we need to pay attention to, but finding the people to fill those positions is the challenge. So, if we've got staffing identified as number 1, but we know that we can't potentially fill the spots, then are we bound by the results of the survey?
We don't think we're still trying to figure out why this is a very important piece. We understand, we want to gain insight from our community, all the people who are important, but they put a lot of emphasis on this survey and this meaningful consultation. So we believe that they are going to look at our monies and say, were they part of that? Now, I think we can justify those things. If this is what says on our survey, when they come and we haven't maybe spent a lot, but we can have a conversation about we tried, or we didn't get anybody, or, we decided to do this. So I think there'll be some leeway. I think if you had something that was not on your plan at all, that was like in left field, and you just decided, I think we'll just do this, and I think that might cause a red flag. Again, I think KDE is just really trying to feel their way on this. They didn't realize they were going to have to approve our plans until very late on the game, but the federal government said, yes, you will. So I think we're okay, even though staffing is the largest. And I think part of it will be communication, and we can continue to come back. We have several years. I don't, as I shared with the board the last time, we'll continue to kind of, if this is good, this is what you like, we can kind of keep giving that update, in this format. If you like this, just to tell you where we're at, and then if you guys hear anything and let us know. Yes, we do want to do an active search for something else, or and then we'll have a little bit more, but we're open to anything else prior, because we will resubmit our narrative. We feel confident with the changes and the tweaks that we made, and we'll have you as another piece where we actually met in person to add to the narrative. But everybody's pretty much worried about the same things: parents, teachers, students. And I think people say staffing, and they know the same thing that we know. Some of them do not have a homeroom teacher for their child right now, so they understand that, it's not, so.
When we looked at homebound instruction and they're in quarantine, so that homebound instructor is going to be kind of like a virtual teacher, because she's not going to be able to go in there. So what we're saying there is we're looking at homebound instruction a little differently, which is right, which is great.
Yes, and that was just one of those things that we knew that potentially we've heard, might look different, but we felt like that needs to be done by somebody, who can really focus on that, and not, hey, trying to find a teacher, something streamlining that process. Same is true in C. If we start to look at where are our students, because some have been on virtual, and where, some of the bigger districts always have that. We may not, with this people, afraid, or moving, and we don't really know. So that might be something. So we'll just, like I said, we'll kind of play that by ear and always come to, conversation on that.
It is on page, let's see.
Sorry, wait,
4. Yeah, more.
Well, there's several graphs. Those are taken directly from the.
So that response rate, you see that staffing was selected by 232 there on that.
Would that be misleading also on the parents and?
No, that, I think that was the question that was, you know, what do you maybe think this, see, the areas that you think are important for expending these funds. So it's not where it's not the pool of people that they're coming from, it's where they think the money should go.
Thank you.
Yes, sorry. No, I'm sorry. I'm sorry.
That you- Any other questions on this update? Yeah,
Thank you all very much.
So the next item on the agenda is construction project update, and I know that we touched a little on it.
Correct. So that's that is part 4 or 5, I guess. So in the eyes of KDE, we actually have 4 active projects that you already are. The first one's finished in Marion County Middle School, which the actual Hvac 4, which closes out the construction phase, if you all approve, and KDE's approved that. So now we're working on Hvac 5, which is on our behalf, and you all probably need to be on the September board agenda to approve to close the project. Okay, so that's coming your way. We created the BG ones for both Calvary and Lebanon Elementary. Y'all recently approved those. KDE has approved those, but asked for clarification on the cost, because, which I appreciate, Ross Tarn, I think it's more realistic in the pricing. KDE pulls the pricing off of the district facilities plan, which they just updated in July. Our DFP was approved in June, so the price is a little different. So they just want to ask for a clarification of why the increase, and I think it's more realistic to today's construction cost. They just want that when they move it on, there's no questions later down the line. So I feel comfortable moving forward on for that.
Can I say something?
Yes, ma'am.
On that part? So one of the items on the board agenda for Thursday night is that the board will need to select an architect for the BG one, for the Calvary and Lebanon Elementary. So you'll see 2 line items on that Thursday agenda. One is that we continue to remain with Ross Tarn, or 2, we put out an RFP and put that out for bid. Okay, so that'll be something that you all need to decide as we move forward. And the reason being is because it's a new project, and every time we have a new project, the board has to make that determination, okay? You all have any questions or anything that you would like from RTA so that we can bring that back? Or do you have any questions of any of the 3 of us so that we can try to answer just about those 2 projects?
If we were to go a different route with a different architect, I guess, would they just hand down the stuff that was done prior to, or is that stuff that
We own that.
we own that first?
So what would happen, chose to go to option B, go a different route, we would put out our request for proposals that we have for a period of time. We would take submittals, Mr. Tristan through this, what we did, you can do it a couple different ways. Last time we actually went and interviewed each group of person one night, or you can select the ones you want, and then you can go from there. The fee schedule, just for FYI, is for architect services engineer is a KDE set guideline. It's based off percentage of the project. The higher the cost, the lower percentage goes. So that's a little bit negotiable, but there's a fee schedule for all firms and stuff.
Okay, so that's kind of a set price.
It
It's
is.
not, okay.
How much work has RTA done?
So our RTA's been here for about 20 years now. Their very first project was Glasscock Elementary. Then they did Marion Middle, ATC, we did some other roofs and some stuff. We did renovation in high school, minor roof in 2012. So very familiar with the types of facilities and the infrastructure. And personally, I think they did a great job last little bit here. Marion Middle School, they really stepped up and did a great job.
I'm sorry, in the past, what have you guys done? Is it just kind of
So-
carried on?
You remember when we had
It's
Dog and Pony Show at the high school? That was it. So we had, when we issued RFPs in the past, we had, I think it was 5 architectural firms come, and they prepared some materials for us to look at. There were lots of different firms for us to interview. I think at that time, we had really good options to select from. I think the biggest bonus for Ross Torrent at that time was their longstanding relationship with us. I will tell you, I voted no against Ross Torrent the last time because I felt like, it just felt like that was the bulk of their presentation to us. That being said, I think since working with Randy and the communication that we get from him, I've been really pleased in their work with us and their communication with us. So I think, it's up to us as a group to determine whether or not we want to move forward with that relationship, or if we want to put out an RFP to see architects again.
Also, it may be in our best interest to ask them what their workload is.
They're
Are
very
they-
interested in, they're on board with
Because
us.
I know everybody's busy. Sure.
Do you,
So,
Is there a cost in the changeover? Everybody, it costs money.
Right.
And we're talking,
I guess the fee schedule says the same, but I guess you lose the familiarity and the moving forward, where we been, the building itself, things of that nature. I guess you start from fresh, do that with another additional line. As far as the cost, probably not much you would see actually dollar amount. Do trust.
basically you got new people coming in, they gotta redo everything.
Sure.
do
It's more
everything. So you have
time.
that
It's not more
consuming
time than
cost.
it's actual dollars.
Yes.
and something we may want to consider is just how timely, when we would like to get started with these two projects. If we continue with the folks we have, if the board is pleased with those folks, it may be that we could start these projects quicker.
right. And two, that's why I was.
And I know that's
what their
something that's
workload would
important.
be, right. And they probably very familiar with, since we're redoing Lebanon Elementary, they're familiar with that. But since Calvary's a brand new site, it would be easy for somebody to step in and do that. But if they're working, if we're very happy with them, then
If
they could.
projects we handle, they'll be here a lot of times for project meetings and stuff like that. They will couple those together, try to coordinate and keep us flow. So,
Yeah.
that is
Right.
Building that new school though, is that they were talking about how many children would need to go there. Where are we gonna find all these kids in our district?
good job.
You can comment on that? I'm just wondering about that percentage that we're gonna have to get in order to put the student base in there. So
I
is
think
that
that's
a
a
worry
bigger-
that we still have to have, or?
I think that percentage of students, I think that was part of what they approved in the district facilities plan. Yes, is that math? That we kind of moved.
If you remember, to the board, passed a letter saying they acknowledge that there will have to be redistricting regardless of which plan would be approved. So I think it's going to caveats to approve this BG1. They're going to want to see that there is the intent to move and redistrict to get the allocation of students there.
That was just one of my biggest concerns.
The board approved it, now we said that KDE.
We discussed at times, we're going to at some point sit down and start a formative discussion. And does that need to be before this BG1 is approved or after it gets approved?
I think they'll approve as long as there's the effort, and I think they can kind of go hand in hand at the same time, because, you can obviously move students to the facility.
That's true.
So, but I think they're key, and I think the board at the time, the letter was, will do that.
There was even discussion one time that maybe you could hire an outside firm to come and look.
Yes.
And I think that's still a good idea. I think it's a great idea.
It's a fabulous idea.
Well,
That would be-
well,
Everybody said you're-
apparently we're listening.
Yes. Yes.
I want to know for most of us before we do this corporation, how similar or dissimilar they may look if we were to bring somebody else in. Just to make sure it's being done as efficiently as possible, especially with the increasing demand and need for drivers, bottom line.
The last project is the high school. and this is a big one. That's kind of the schedule we're on. And if you all remember, when we first started this talk, we had a school facility construction commission at SFCC offer every 2 years. We had one starting to expire. That offer expires actually, I can say that out loud, February the 6th. We want to make sure that bond stuff by February 1st. We lose that. With the bond itself is about $42,300 on our behalf. That's for 20 years. That interest rates fluctuate, but that would mean between $500,000 and $600,000 in construction that we would get on behalf. That we would pay it, but the money would flow through here. They would send us the money like payment. So we don't want to lose that money. So to stay on the schedule, you'll see there, the bond sale is currently on about January 14th. We'll be bringing you all some, we notated about, make sure they know about turning stuff in on time for this session on Monday, in case we want to discuss prior to the board meeting on Thursday. So they kind of redone their plan of calendar. Bids will go out and open around the middle of November, with construction to begin about the 3rd week of January. So we started having some meetings about phasing, what that would look like when Mr. Peterson came over and met with us as well, where he can move, have class still going on. The building lends itself to have that pretty well right now. So I try to do it intentionally to disrupt services as little as possible. And then once we bid those offerings too, we'll know more what offerings are taken and not taken. So it's kind of a very area right now to know the schedule for certain, the exact offerings. But we can start January of 2022, minimum of probably 18 months. I guess what the goal would be to open it up in August of 23, so 2 years from today, roughly, we would have a complete project to occupy the full steel building. So far we're on schedule. I just want to stay on schedule. We don't want to lose that.
And you said that was February 6th?
February 6th is when it actually expires. We don't want to get midnight burn. We want to sell about, right now it's on here for January 14th. We could go there, a little bit over that, but not much. We want to stay on schedule as much as possible. Part of that's going to be, you see that the claims to go to KDE, housing and construction for review, for compliance. So some of that's kind of out of our hands. We have a lot of 50 days in there for that. But we start looking to get to there and start missing holidays and things like that. So who knows what COVID's going to bring, and people work from home, so we want to be intentional and keep going.
I know the board's talked with Ruth Ann and Shelley about Esther's funding for HVAC. And so part of that construction update is I know that you all are looking at the entire district facilities plan and those needs. So do we want to move forward with BG1s for HVACs? Do we want to think about that a bit? Do we want to do? I just want, if you would like that on the board agenda for Thursday night, I want to make sure that that's added. And that's kind of what I'm thinking with our work sessions. As we go through these things, you may say, let's add that on Thursday night, or you may say, hey, I need you to gather up some more information. We'll talk about it at the next work session. I'm hoping I'm reading you all the right way with that. So I just want to throw that out there to make sure that I'm carrying out. Yeah, I mean, that's the whole point. Yeah.
Right. So obviously the West Marion HVAC, was there anything else at West Marion specifically that is that high of a priority?
Well, we just got to be careful, make sure that we're going to use extra funds and meet the qualifications.
Right.
Unless you start getting to other things, we have to use general fund money or bond money, which we're kind of pretty much got bond tied up or bond potential.
So it would have to be its own. The HVAC would be just its own.
We want to do a standalone project, avoid prevailing wage on anything else.
Okay. Yeah.
So are we looking at the ESSER funding to do the HVAC, or are we looking at setting that out for another type of
I'm
funding?
not sure we can afford to do it, the bonding potential, until we got all the bids in, because it's exactly what it comes in at. Right now, we're at that, what, that 40, Chip was here a few months ago, I think referring to roughly 40 million.
Right.
If you take what we're at on the high school and what the potential cost, projected cost is for London Elementary and New Calvary, we're about the 100% mark of the bonding potential. So we do with any other funds, ESSER is one or cash, and watch that too. So, and Shelley, we think this is going to be ESSER 3 approved thing, but we wouldn't want to go down the road and make sure we got approval for it because they could come back. We can code anything you don't want to ESSER. The operator gets a hold of it and says it's not allowed, you got to take it somewhere else. And at that point, you already spent the money, therefore it's coming out of junk. So the good thing about a construction project, we're using ESSER's fund, is we will have to do a BG1, which we sent to Frankfurt and approved by the folks up there. So that gives us an extra layer of, you gave us permission to do this with these funds. So it's identified, the funding source is also identified on the BG1.
So you highly recommend.
Yeah, I mean, it's good. I like the West Marion. I think the top section, we talk about being 33 years old. I like the maintenance of equity is a concern because of the parameters of the grant, of the fund from the ESSER funds.
It'd be really hard to do just West Marion when you've got a Glasscock Elementary that's one of your higher priority needs, and that part that also needs their air quality address.
And the thing is, they're both, since Glasscock's a larger facility square footage wise, but where it's already on geothermal, the cost of the two buildings are very similar in it maintenance of equity. So it would, I think it would help maintenance of equity.
The elementary to elementary.
Yes. It's when you're identified high priority schools to this program.
So you think maybe do both of those elementary schools or tackle those?
Correct. So if you did those two, it's a 1.75 roughly piece, about $3.5 million, that are 80% is a little, about 5.5 or so left. So they give you about $2 million still in that ESSER 3 of the 8 that fund.
Right, but Shelley, we also have put back 1.4 million for learning loss, correct?
Right.
And that 1.4 million for learning loss could be what we've talked about with our staff that we can put back for homebound or things like that. So we would be spending some money. I just know that the board's been very adamant that we try to do something for every school if we can in regard to construction.
And the great thing is, regardless what we do, Naughty Academy was put in the first, HVAC was replaced in the first project, 2015. You're going to do the high school here, elementary, in Calvert. ATC was put in 2010. That really only leaves 3 buildings. Glasscock, start with those, West Marion, Glasscock, and Middle are about the same. So you get all 3 of them. You're going to have some pretty new, updated, long-term HVAC.
And is that something, because timing is everything. And if you're, is the timing now or the next 2 months from now, or is it something 6 months from now, or is it something? I don't want to go with
We
this.
would have to go on a budget that though, wouldn't we?
And
So that'd be done pretty quick.
What did you say, Shelley?
I have to have a spending plan by August 31st. That does not mean that I cannot ask them to reopen it and change it somewhere along that way. I'm fine either way, whichever the board, if you want to do 2 projects, 1 project, all 3. I mean, but that's part of, it did show up on the survey, indoor air quality. It isn't allowed one of the 20. We just need to be very mindful that that really just leaves us with the 20% for learning loss, and no other funds can be used other than for learning loss. So that just takes a big chunk.
Plus, it's likely that if we did ESSER's money for those projects, that a guaranteed energy savings project would probably be off the table just because we're.
No, actually, they're saying, the short time we looked into it, that there are eligible expenses, use your extra fund for potential.
No, okay, so we can do this together.
Yes.
And any savings, can it be put back into the ESSER's fund?
Utilities, general fund. And regardless of doing HVAC projects, we really want to focus on timing wise to try to get it done this summer. It's a very difficult task, especially if it's mountain ceilings. If it's throw ceiling out, it's just a dangerous, for people to be occupying. Money and stuff.
And grading, of course, West Marion would be number 1. You said the other 2 schools are side by side. So what would be 2 and 2A, I guess?
I suspect just because of age, Both of them at the original portion of the building done in 1998. And then Glasscock got their expansion areas in 2002, and then Marion got their expansion in 2006. So the original part is the same, just by the time construction process. So Glasscock, I guess technically by age would be 2, and 2B would be Marion.
But Glasscock would be more suitable though under the
And like the heck of it is.
Yes, it is identified as one of those, which I would, I would caution if you are going to choose West Marion, then you also choose Glasscock, because I think you're safer. I would feel a little bit safer in the fact that if somebody's gonna come to me and ask me how we spent this money, and I have to say to them, well, hey, we did West Marion, but I had a school that was, identified as my highest poverty, and I knew that they had HVAC issues, but I said, even though West Marion's is 33 years, I just don't know how this meaningful and this maintenance of equity, it's not been done before. So again, it's not like I can compare it to anything else, but I do know that there's been a lot of emphasis placed on, that. And with only 7 schools, we had to identify 2. We could have done grade span, but that's for larger districts where you pick your best, your top elementary, your top middle, your top, well, that doesn't really work for us because, that's just 1, 1, 1. And so our top 2 are the 2 elementaries. And one, which would be, when one is going to be, the other priority school is going to be addressed in
So
the other thing. Anyway, so really you're going to, if you would do West Marion, you would do Glasgow, you'd be hitting your 2 priorities plus hitting the biggest needs. So if that is something that work, I will just, need to know and budget that.
So would it be a good idea to say do those 2 schools, leaving the middle school, since it's not gonna be till 2024? Still keeping it in mind that it will need to be updated, but to go with those 2, and then we still keep back that extra money. And then say when 2024 comes around, if it's still possible, then that comes up on it.
I think it is, and as far as getting it great by Thursday, I think we need to look at if you want to possibly entertain performance contract. I'm not sure we can turn that around before that, maybe the September meeting. It gives us more time to make sure we're got all the ducks in a row before we put a better plan, if that's okay. But I do see what you're saying, that will provide her maintenance equity, so.
Yeah, I mean, I think that sounds good to me. My only question is you said your budget deadline's August 31st. Now we have a work session scheduled, I think, for somewhere in there, who knows, calendar wise, mess right now. But if we were to put the Glasscock and West Marion HVAC BG ones on the September agenda for approval so that we can get performance contract stuff lined out, put those 2 pockets of money together, would you still go ahead and budget those?
If that's the way I believe the board is leaning, then I'm going to place in the codes for the 553, the maintenance for that, so that I can either put in 3.5 million for the 2 projects and then budget the rest. And then if we need to go back later on, when we see how much, because what if it goes over, you know what I mean? Then I don't want us to get into, that's my other thing, when you're at 5.5 million and you can only spend 5.6, that worries me. So I can budget the 2, that leaves, it's less than half on that as well. So, and then I feel like everybody gets, our 2 priority schools will be addressed, whether it's through ESSERS or that. So if that's what the board sees fit, then that's what I would put in the.
Why would we not go ahead and do that at our board meeting? I mean, what?
On Thursday, so that we could look at including a performance energy savings contract to get those numbers included with it.
That's something we get turned around from that.
At some point, if, I mean, you would put it on your schedule, and basically it's like a preliminary approval, is that what it's?
This is what goes to K to E that says this is how we're gonna spend our money. Should we change something so drastically in the millions, what happens is I would have to open that all back up and have it all reviewed again. And then if we wanted to move another, whatever, 2 million or however much that is, if we're on point, then that would have to be then reapproved again. So, but again, everything would have to be finished and completed by 2024. So that money would have to be spent, done.
Okay, so it's not a situation where come 2024, we can keep the other 2 million for the future.
No, we have to spend it by, that, and that's on that sheet there. The September 2024 is your
sure we can do that. I'm sure we can do that.
But that sounds good to me, if you could.
More on that.
So I'm gonna put 2 West Marion and, Blackwell.
And you all are gonna work with on that, and then we'll bring that back to the board in September. Is that good on construction? Okay.
That is 1% each.
Out of the 8%.
1%, so there's two.
The hard rubber 5.6.
Yes, 2.1.
And for other, and then we still have the 20%. That's,
Right.
Yes.
That's what I'm thinking.
Okay. Item 2C is reentry plan and COVID discussion.
You may want to set the camera so you can be a part of this discussion. As you all know, we start school with students in person on Wednesday. I know folks are excited about in-person learning. The last time we talked about our reentry plan, we followed up with our board attorney, and he agreed at that day on that time that, you know, we would do the mask on the buses, and that otherwise it was just recommended for anyone else unvaccinated to wear the mask. Since then, been a couple of weeks since then, we've had some updates and some changes. And I know with school getting ready to start, that we wanted to talk about this. And I know that Mr. Lyons, you know, he's our healthy at work coordinator. And he has been monitoring. I sent out the flow chart that we use for the quarantine. And I'll just turn it over to him because that's it. He's an expert at this.
Well, it's fair to state that I have no medical degree, but I'm a pretty good parent. So what I get off of, you know, from the health department and guidance and things like that. So I think our recommendation right now, or what our plan is that we up to this point been recommending masks worn by unvaccinated people, students and staff. But that guidance has now changed due to the contagious nature of this Delta variant, which actually has a higher concentration of the virus per person than the previous version. And so it seems to be capable of overwhelming vaccine immunity that's been built up for a lot of people. So since we don't know the extent of that, the health department is now recommending that it just be universal masking. And I think that that's probably the safest bet for a district to take, because it's a simple request that will keep kids in school, which is what we want to do. And it comes with some additional aids. For example, in schools, they've already reduced the radius for contact tracing to 3 feet or less. So any students who are outside that 3-foot distance, which, you know, we're not going to completely be able to do in classroom, but we could do a better job of looking at 6 feet. And if they are masked, anyone outside that 3-foot distance with all students masked would not have to quarantine. So that would reduce the number of quarantines that we would have, because we most certainly will have positive cases. The highest group of people who have it, who are developing this infection right now, are in 20 to 40 age group. And the 18 so are just right behind. So those are the fastest growing groups. And it lines up with people who are basically, you know, previously genetically vaccinated, because, you know, and I understand they feel like they're healthy, they're young, and it doesn't seem to affect them. So they haven't been as prone to get vaccinated. So that's what we're seeing. That's the data as it is. And that's my recommendation.
I'd also like to remind the board that last year we were under an emergency order, and I could elect to do an NTI day, non-traditional day, anytime I want. This year, we only have 10 days. Once those 10 days are used, whether that's for snow, flooding, flu, COVID, then those days that we make up will be at the end of the year. And so that's something to keep in mind. 2, attendance this year counts. Last year, again, we were under an emergency order and the attendance was from the previous couple of years. And the third thing to keep in mind is we've got to have so many staff present to either supervise children, pick them up or feed them. And we did a good job with that last year. We scrambled around, helped cover classes. Ms. Wheeler and her staff had to go in the kitchens. We had to feed, but you know, you do have to have a certain number of staff. But right now, as of today, we only have 10 of those days. That's not to say that tomorrow we won't receive something different. Just that's where we are today.
Can I ask a question?
Yes.
Is there any guidance? Like I know right now, Washington County, Marion County, kind of in the red, numbers are coming out. And so when we come out of the red and we see that it's coming down, we can then revisit the mask, correct?
The guidance says that it stipulates that the recommendation is for universal masking in communities of high spread. And it stipulates orange and red as colors. Those are in parentheses in the documentation. So, you know, that is something that you might want to consider. You know, if we go back into yellow, then we could maybe relax these requirements. But it's just a simple common sense approach. You know, I hear a lot of people talk about, you know, the kids can't stand it, but you know, the kids really adapted to it pretty well last year. And, you know, I just think benefits outweigh the costs that comes with it. It is a hassle. I don't like wearing this right now, but you know, if it'll keep me in my job and it'll keep kids in school, then I'm gonna do it.
I think,
Yeah, I just want to make sure parents have some, like when it gets to a point that we're not in the red or orange, parents have the right to send their children without masks. If that, you know, they can have parent choice. And I think that's a lot we're hearing is parents feel like they have no option. But we also, I think, are limited in our options whenever we're in the red and we're at a crisis point in our district and we know it's spreading. And I kind of shared, my husband had that experience at work today. So it's here. If we can kind of tap that down and be really safe, then when it eases up, then we'll come back and revisit again as a board. I would like that.
I think it's, I mean, mask mandates and universal masking is absolutely a challenge, and I understand everybody's frustration with where we are right at this very moment. I feel like some of the things that we can do as a district, because I know a lot of people have concerns about everybody wearing them for the length of time that they would wear them throughout the day. So, you know, I would want us as a district be intentional about scheduling outdoor mask-free breaks. You know, as children are outside, and I know that the elementary schools have been great about getting recess for their kids or things like that. I would love to see us be intentional about that from preschool to 12th grade about outside mask-free breaks. I also know that we as a district, you know, invested in PPE, and a lot of that was the purchase of masks for kids who forgot them. But I also know that when I dropped off Eleanor, she's like scrambling to get her mask because she's got a mask that's comfortable, and mommy sprays lavender spray on the inside of it so that it's not, you know, so it's more enjoyable for her. And so she would rather turn around and go back to the house to get her mask than wear the paper one. So are there different investments in PPE, whether it's, I don't know, strawberry flavored masks or whatever, that just make it, that communicate, we as a district understand that this is challenging. We understand that it's uncomfortable for a lot of people. I know that, you know, I'm a glasses wearer when I'm looking at screens, but masks fog up my glasses. So are there things that we can invest in, whether it's flavored masks or an intentional schedule that allows for outside mask-free time, the renting of tents to create a space for outdoor classrooms? So what do we as a district need to do to say, we get that this stinks, here's how we're gonna support this and hopefully make it a little bit easier. And as we continue to reevaluate things with this variant or with any other variant that's gonna come our way, that we maintain that sense of flexibility and reevaluate our plans as situations would warrant.
I think there's lots of options. If you look at the guidance right now, is all this is for inside, masking is inside. Outside, as long as you're not congregating in large groups, well, maskless should be fine. The concern is that, like, if they're out here on the playground, for example, and they're running around and they're on the swings and things like that, they don't have to wear masks. I mean, they're not. The only time you would worry about that is if they are congregating in groups in areas around 6 feet together for long periods of time. Because remember, exposure is about 15 minutes of time throughout with a positive case throughout the course of that day. So, yeah, I mean, outside I think is are good options, and right now the children can't get the vaccine, so whatever we can do to help make those cases be more protected, I certainly we can bearable. And I hope, I can't say for sure, but in a lot of cases, this Delta variant has peaked really quickly. And so we may be out of this by Labor Day or fall break. Of course, the cold and flu season comes back. So who knows what that might bring, but it certainly will not be free. I mean, certainly.
And I think from what I've heard, most people, there are people who feel strongly about it on both ends of the spectrum. I think the majority of people lie in the middle where it's, I want my child to be in school in person. And if that, whatever that looks like, that's what I want it to be.
This time, back in the spring when we were in the red, we were not in school. We were not even talking about going to school. So I think it's
Great.
that we can talk about going to school. We're in the red, talk about going to school. Well, I want to do whatever we can to really make that happen. Get kids in school and keep them in school, because I'm kind of hearing the same thing. A lot of people do not want to go back to the virtual world.
Hear the same thing as everybody else, so we're all getting it. We all want the same thing, so.
I may be hearing no mask.
Yeah.
I've talked to a couple of high school students, and they say that they cannot concentrate all day because they're doing this. These are students. Talk to parents. Parents want a choice. Parents want a choice. I look at this very first statement: students and staff will not be required to wear a mask in school, which has been in the last 2 weeks. Now we're looking at changing it. It says, however, Marion County recommends that students and staff. Did we get that from the CDC or from the local health department, or where did this statement come from?
Yes, and our board attorney.
Okay. And so now they're saying that everybody wear masks.
It's an intervention.
It's an intervention.
Intervention to prevent the spread. Try to keep the numbers as low as possible in the states. Like I said, with some of the options that we have with contact tracing, that makes that process a little bit easier there, so that we get the quarantine. I think also the board attorney concerned about if we didn't follow that guidance or something.
He said he just was, I think, we had another question for our board attorney about another issue, and he just asked us what we were doing, and we told him, and he said, I just don't want to be the first school district that is challenged in the event that something happens with the child. Because you have the health department saying that we should be doing universal masks. Now, we did this before that came out, and that's the problem, and that's one of the things I said, is that unfortunately it could change tomorrow at 4 o'clock or tomorrow at noon. And one of the things I shared with my staff is that, please be patient, because a lot of the times we hear these announcements at the exact same time we do. There's not something coming down from Frankfurt that says, here, Mr. DPP or Mr. healthy work coordinator, we're gonna give this to you before it comes to us, so I don't, just please try not to be too upset with the messengers, okay? You know,
I
it's
think
just,
that's like me telling me, I was sitting there listening to the governor, he's like, in possible litigation, I'm like, wow, you know,
Yeah.
thank you for.
well, that's what our,
Putting that out
yeah,
there.
our
We can-
attorney said.
We can be sued over anything.
That's correct.
I mean, anybody can threaten to sue us for anything, so that doesn't,
Right.
that's not a scary thing. It's,
And,
What's-
and I just want to make sure that I always keep you all in the loop on those kinds of things, okay?
And we still do understand that there are some children that aren't able to sustain the mask, and we make accommodations. for
Yes,
that.
absolutely.
So,
So what about, okay, the 3-foot rule, that's with mask, without mask, what is that? Okay, so is it still 6 feet without mask?
It's 3 feet in the classroom. It's 6 feet for adults regardless.
Mhm.
That comes from the fact that adults are more prone to develop adverse reactions than children. But if we do universal masking, then the quarantine for those kids that are better than 3 feet away is not required unless they begin to show symptoms. So if you're a teacher in a classroom, you've got a seating chart. If we did optional masks, then we would have to try to remember who was wearing a mask and who wasn't. Whereas if we do universal masking, that solves the problem for you. All you need to know is where the child sat. And then who was within 3 feet of that person for the potential contact trace that we have to quarantine for.
So there's not a space far enough away for setting desks that, for no mask?
We can do better with 3 than we can with 6. But 6 is extremely.
But just say that you were to set them 6 feet apart. But I'm just thinking if there's a classroom that has 8 people in it, is it possible that they could space out enough to take off their mask?
If they're over 6 feet, sure.
That's what we get at. So what's the spacing like now on classrooms?
I went to open houses at 2 different facilities, and the spacing in both of those buildings are not amenable to sitting students 6 feet apart. And I think what allowed us the capability to do that last year is because we still had, the option for a lot of families were still selecting the virtual option versus sending their child in person. And even though, those percentages at some schools, like it was 7% of kids were selecting virtual, it still gave us that little bit of space. I don't know that we're seeing percentages that have this year people selecting that virtual option, are we?
We have more students than we usually do for a virtual option.
Sure.
But, and it may go up based on, what all sides do. Because we still have that option, but it is not the same type of virtual instruction. For elementary students, it would be somewhat similar, but certainly for 6th grade on up, it's a different mode of instruction and relies heavily on students being self-motivated.
So are we still at, if somebody has COVID in a classroom, is it that whole classroom is quarantined as together, or how?
What you would do is if, let's say I'm a positive case, any people who are sitting within a 3-foot radius, less than 3 feet radius, if we're not wearing masks, would automatically be quarantined. If we're wearing masks, then anyone who's outside that 3-foot radius would not have to quarantine. It would just be me and whoever's sitting right next to me, or, let's say on a bus, for example, where we know we're going to do masks universally. For the bus garage, if they have a situation, then the bus driver can just give us the seating chart, and typically we get kids sitting next to me. Because you probably have a distance enough between front and back seats to not have to quarantine those things. Because we would know all of them were masked. Once again, if it's optional, then it's going to be more difficult to know. Well, we're just going to have to quarantine them. I don't remember whether they had a mask on or not. So we'll just, and both parties have to have the positive case and quarantine, the contact would have to have a mask in order for us to meet that criteria. So that's something that I think the health department is allowing. It's probably not what they would do if they could, because they're very, very conservative. But they understand we have limited space. We have limited space and size, and I think it's an accommodation that's being made to try to keep this. Because this was not available to us last year.
Just that I feel like we were kind of on a different rule set from where we were at last year. So by masking with this 3 feet, we can also reduce, you know, those going to quarantine, keep our numbers up where attendance is going to matter.
Yes, that's exactly.
What do we do with the students who refuse to wear masks? They're constantly taking them off with stuff.
Well, I
Because I
mean,
know we're gonna have that.
we had some issues with that. I did some, worked in the lunchroom a couple times last year because they were down on staff. And, I had some kids came through that had pulled down, and I would just do this number, pull on my nose a little bit, they pull back up. Never got any negative feedback. I think they get used to it. I find myself in my office sitting there for 20 minutes with my mask on. I don't need to have it on. There's nobody in there. I just forget that I have it on. And I think that's the same thing with them. And they start talking and it moves its way down and they're just, I've not seen anybody be, that doesn't mean that we wouldn't have that issue. But if that's going to be our policy, then we can just deal with it as a discipline issue against one of our policies.
I agree with you about the kids. The grandbabies are telling me all the time, you need to put your mask on, let's go.
But with that change, that may be enough to get us over the hump quicker and get us to a point where we can be more comfortable in the classroom. Because certainly we want to be there. We want to be there. And but it is real. The numbers are beginning to climb. And
I agree with Debbie. I think in the red, I totally understand. But when we start to go down, we can become more lenient.
So let's see, I think there were other pieces that we wanted to talk about on the COVID discussion, COVID leave. Well,
I know that Ms. Spalding had talked about spacing. Is that right? Did we hit that while we were talking about the
I think
spacing?
we did. We did the
Okay.
3 feet, and then what Carrie was saying, I thought it's important too, to give them mask breaks, like going outside. Trying to give them an opportunity to get some fresh air in there, and try to do this like we do sitting here. And I think just being very aware that when we come out of the red and orange, that we are really contacting parents. Maybe we can do, that one call and say, we're out of the red orange zone, that it's optional for masks. If you want to continue your child to be wearing a mask, then so be it. If not, then it's not mandatory. Letting parents have some choice in their child's health, I think would be important.
yeah, I think that would be a circumstance that once we get there, that we have this conversation again.
And I think that's just letting parents know, we're not saying the whole school year, we're gonna be masked.
Right.
That we will look at it.
On the reentry plan, I think there were other pieces of the COVID discussion. The leave policy. Leave policy per se.
Yes, thank you. Another thing that came out last week, last year that we had was the leave policy. And that was that in the event that someone had quarantine or someone had COVID, they did not have to take any leave. And when we met with staff on Wednesday, at that point, we had been notified that in the event if you become quarantined or you have to stay home with your child, then you have to take your leave. Later in the week, again, we found out that in the event that you have had your vaccine and you have to quarantine, that you do not have to take leave. But if you have not taken the vaccine, you do have to take it. And so, but part of that is in the event that there is a what was the word they used about your religious belief?
Sincerely held religious belief.
Yes, then I guess we will have to work through that.
Yes, if you can get an exemption from that requirement of the vaccine. Because currently, right now, one thing I did fail to mention was if a student, which right now would be 12 and up, is vaccinated, if the staff member is vaccinated, they are not a close contact. If they're a close contact with someone, they would not have to quarantine. It's sort of a get out of quarantine free card.
If you have your vaccine.
If you have your vaccine,
And you're
only if you're fully vaccinated, that means the 2-shot cycle and you've had 2 weeks for it to take. Then you're considered fully vaccinated. So if you're in that category and you're a close contact with a positive case, you currently do not have to quarantine unless you begin to develop symptoms. So for students who've had a vaccine, that's another thing, we have to find out from the signature. Okay, any of these kids who saw my flow chart, it had it on there, any of these kids vaccinated. If they are, then they're excluded from being a close contact. So you'd only be doing then the kids that were unvaccinated or the teachers, staff that are unvaccinated. So the leave option is for anyone who's vaccinated would get, I'm not exactly sure how it's going to work, but they would not be docked their sick days. And anyone who, or who has a medical reason for not being able to receive the vaccine, because there are people who can't get it, they would be exempt from that, as well as anyone who has a sincerely held religious belief as a wording that would prohibit them from being able to take the vaccine. So those would be exemptions that they laid out for. And so you just on sick time.
And that's a regulation that was recently handed down by the Kentucky Board of Education, yes.
Thursday.
So they write the checks to the people and they keep track of who's been quarantined and who's got their shots and all that. So like,
Give me an example.
well, so do we have a way to where if somebody doesn't have a shot, that we can give them their days back? Yes. I mean, it's kind of discriminatory is what it is. Let's say you're giving people days that have their shot. You're not giving people days that don't have a shot. I know what they're trying to do. They're trying to force them to get their shots. And we've already seen emails and we've had people already asking about that. And so as a board, that's coming down from the state regulation. Is there anything as a board that we can do where if we don't think that's right, we can say, hold on a minute. We want to take care of all of our teachers, not just some teachers.
I think that would be one of those things I would have to talk to our board attorney about.
Okay. Because I think that we want to support all of our teachers, not just some of them. I mean, we want to acknowledge what they think and believe in. And it may not be religious, it may not be doctrinal, it may be emotional. There are people that are scared to death of taking a shot. I can tell you that. I've heard many people say that. And so, where does that fall? We are always talking about emotional and social learning. What about emotional for the teachers? I'll say this, if we as a district can do something, we should do something. And we talk about recruiting and retaining. If we do something special where we take care of our teachers and all the districts around us aren't, then people would want to come here.
And I would hope that between now and Thursday, that'll be our first day of school. And I know we're having a board meeting. I think I would think within the next 2 to 3 days, I could give an answer on that.
Okay.
Give you options, to give the board options. When I say you, I mean all options of what we can do.
And with that said, do we know the rate of how many people have vaccinated, how many have not, teacher wise or employees? Let me rephrase that. Is it all employees or just teachers too?
It's all in place.
It's all employees. Okay. So do we have a percentage of vaccination rate right now?
I only know how many we delivered the vaccines to because it was my task to organize that. So I know that we dispense, how many doses we dispensed to arms back in February, March. I don't know how many have received the vaccine since then. It's not really anything that we seek the information for. The only reason we would ask someone if they've been vaccinated is whether or not we need to quarantine them if they've been exposed. That would be the only reason we would need to know.
So I guess my question, getting back to my original question, is how would you know if someone when got vaccinated or didn't get vaccinated for that? So,
We get a vaccine for it. So they
Right.
they produce the
It would
evidence.
just
to
be a
show.
question.
if it's being
upon-
questioned,
Right.
it's gonna be a case by case.
Yeah. So I know that there are of course vaccinations required for students when they attend school. I'm assuming that they're similar. I mean, do staff have to turn in, like, on initial hire, COVID vaccine aside, do we have medical requirements that are put on staff?
Just a TV test.
Okay, TV test. What I'm asking is, what process do we utilize for individuals submitting either the results of their TB skin test or that they've gone to get one? Like, are our school nurses providing those on site so that we can better ascertain the percentage of our staff that are vaccinated, or a process for even students submitting vaccination records? As well, if parents would
I know
like
how,
to do that.
students work. I'm not really sure how it works with staff. That's a big question, and it's one that I'm sure is going to come up. For students, the state has provided a very simple, little, what I call a menu, and it has each of the required vaccines for attendance in school. And the COVID vaccine is not one of them.
Right.
Parents can simply choose to opt out and have it notarized, and they're covered. That's the extent of which they have a choice in whether or not their children get vaccinated. So measles, mumps, all those types of things, they can opt out, get it notarized. It goes into our system as notated that they have opted out. When a student does receive their vaccine, that information is loaded, is somehow loaded into our school information system, so we can see who is compliant and who isn't. And those that we find that are not compliant and done either, we contact throughout the year to try to get rid of those. And in most cases with our Healthy Kids, they can deliver those vaccines on site.
Sure.
So that's very convenient for the family, because most families, it's just a matter of scheduling. It's not really a matter that they're opposed to it. It's just hard for them to schedule a time to go take off work, take their kids, get in the vaccine. So we try to make that as easy as possible.
And my question really is surrounding just us understanding the percentage of our staff and our students who are vaccinated. So we know where we are and how big an issue, the COVID leave might be for staff, because I think when we were offering vaccination clinics for staff and you did tackle that scheduling beast that you did, I think we were around almost 60% at that point.
I think we're somewhere between 60 and 75%.
Okay. And so,
At that time,
Right.
I understand.
right.
Have gone,
Exactly.
it moves around.
So my question, figuring out, because what I would want to see, if we were opting to cover the leave for staff, then I would assume that there is a cost associated with us doing that, yes. And so I would want to see kind of a financial picture of the percentage of staff that we have that are unvaccinated, and let's say that they only have to be quarantined once during the school year. Then what does that look like financially speaking? Because I understand where you're coming from, is wanting to support the staff. I understand. I work for an organization that has mandated vaccines at this point, and so we're getting questions there too. So I understand, the concerns that people who are unvaccinated have. I get it. It can be very scary. But I would also, as a district, I don't think that we would be doing our due diligence on something like that without understanding the potential financial impact on that one. So if there is a way for us to ascertain the true percentage of staff that we have that are vaccinated and unvaccinated, so that we've got a better understanding of, if we opt to do something like that, here's the number of people that we're talking about, and here are the financial implications of us doing that.
For how many days that a person would have to be quarantined? I have heard about Fort Knox. I haven't heard, and it's like
I think
90 days at Fort Knox.
It is not 90 days here.
14 days.
How many?
14.
And I can't remember, are there ways for decrease, I mean, 14 days is safe,
14
right?
day- Well,
You have to get, what, a negative test?
the quarantine is 14 days. And you have an option, there's two options in there to get quarantine early if you're asymptomatic, we have no symptoms. So if without symptoms, you can get a test and be out on day 8. So you get tested for the 7th day, and then you can be out on the 8th day, and back after 7 days. So you only did a total of 7 days at home quarantine. But although you're released from quarantine, you still have to wear a mask for that duration of that 14 days. So if we're doing universal masking, that part's settled. Anything you're gonna wear a mask. So for anybody, and we can test in our schools. So if a staff member is close contact and they have quarantine, then they could do just 7 days and be back at work. Because they could get a test from us and then they could start back on that 8th day. So
And this is 7 calendar days, not 7 school days.
7 calendar days, correct. And then it's 10 days. If you're remaining asymptomatic for 10 days, you don't have to get a test. So you can do 10 days. So 3 more days of quarantine, and then you can just get out without having to take a test. So if you're test averse or never can get a test scheduled or something like that, you can get out after 10 days if you're asymptomatic. So those are 2 options, and a lot of people did that last year. When they offered that to us, they dropped it straight 14-day requirement. But it's important to remember, it's still really 14 days. You're just going to take, it's kind of like, I hate to use this analogy, but it's kind of parole, where you're actually out on the street, but you still got to fill out the rest of your sentence.
And to be productive in general population.
And the reason I bring this up, 2 reasons. 1, I want to take care of the teachers, but 2, we don't want teachers with the idea of we need to hide COVID just so that they have to take off and keep their days, or not just teachers, but employees in general. We don't want to do something that encourages them to come into work sick because they want to save their vacation days or their sick days. We want them to, if they're sick, then we want them to receive the treatment they need and keep everybody else healthy.
So on that front, Ms. Slosser, if you'll contact the board attorney to see our capabilities on coming up with a supplement for unvaccinated staff in their quarantine leave. And Scott, you can come up and it's
Teacher salary and maybe an extra side for staff member.
and what a, one quarantine would cost. Any other requests for information on that front?
Would you pay them for the whole 7 to 14 days, or would you pay them for a few days?
I would think that you pay them the days that they miss. So if they have to take off on actual Friday, Saturday, Sunday, I wouldn't think it'd be, it would just be.
Regular.
Yeah, I wouldn't. And
I would think if we were gonna cover quarantine leave, we would cover the entire quarantine rather than, and I would wanna look at, like, if we're supporting unvaccinated staff in this way, I would almost wanna say, look, we're gonna cover your leave, but you need to go get a test after day 5 if you are asymptomatic. So that,
right.
so that we're not covering 10 days. So yeah, I think that's a good question, Peggy. In thinking about it, is we would cover, if you don't want to get that test, okay,
Then that's on
those days are yours. And I'm still, again, I get organizations that are mandating the vaccine. I get why we are, why employers are going in this direction, where it is, in the early days, it was let's offer incentives to get vaccination. And now it's, kind of like with kids, I will give you a sucker if you'll get on that soccer field. If you're going to continue to act a fool, you're going to come out. And it's kind of made that shift. And so I understand that thinking. I also understand the concerns of people who are scared and who have questions and who have things like that. To those individuals, I would just say, please have a conversation with your doctor. I get that we've got, info all over the place. talk to your physician that knows your history, that knows who you are, who probably knows your family and your dad and your granddad. Have a conversation with that person.
With that said, what does it take a doctor's note to not do it?
No. I think in most instances, you have to have a medical waiver, so it's not as simple as a doctor's note. Now, I've got volunteers who have had significant reactions to the flu shot. Their doctors have recommended against taking this vaccine because they have had somewhat life-threatening reactions to previous vaccines. And so I think in my organization with my volunteers, that's how people are able to decline the vaccine from a medical standpoint. Now, I don't know what the circumstances are, but it's not a simple doctor.
Is that something we can ask about for board attorneys as well? As far as
What that waiver
because
form would look like.
could it be medical history? I mean, could it be?
I have a
Is-
sister who cannot
Right.
do back to
Yes.
medical.
And I mean, we kind of got to keep an open mind that there's so many different individual circumstances that we're not even thinking of right now, on both ways, on both sides of it. So that's, of course, not just a doctor's note saying, I don't want to do it, but
I would understand. I mean, if the Kentucky Board of Education is putting forth that people can decline vaccination based on sincerely held religious beliefs as well as medical, disability, I think is the wording that they utilize, that there is a waiver form or a process that they have established for people to do that. And I don't think it's up to us to evaluate what that process looks like. I would just ask the board attorney, is there a process? And if so, where do we find those forms in order to provide them to staff who would like to request them?
We were supposed to have a superintendent's webinar with Commissioner Glass tomorrow. They postponed the Thursday. I don't know what that means. But I can't, so what I hear y'all saying is we need to figure out like what's gonna be our method of finding out the percentage of students and staff who are vaccinated and unvaccinated. And so I think the board attorney needs to weigh in on that. Because I don't know that we can.
And I'm not thinking of requiring they submit the records. It's just, do we have a process? If people want to submit their vaccination record, do we have a process in place for accepting submission of a vaccination record? So not requiring it, not mandating it, but hey, if for us to get a better picture of what our populations are, do we have a process by which people can submit that information if they choose to do so?
People won't pray for something, they will show it.
The cost for covering subs.
The cost for covering subs?
Yes. But covering.
Leave.
Covering. Well, that would be the leave, because that would be such.
Well, if you wanted to be paid for that leave, correct?
Right. I think that's what we're talking about. I mean,
You're
we're gonna be required to cover the
It would
cost of
be
the
there.
substitute anyway.
It's gonna be two.
Yeah, we're paying two people for the same substitute.
Yes, it'd be the substitute.
You're good. Okay. Any other information or requests on that front? So the next item on the agenda is item 3. And item 3A requires a motion. I will make a motion that we consider approval of the updated reentry plan. Question, I think my only question is, the updated reentry plan, does the motion need to state to include universal masking? Okay. So I would make a motion to consider approval of the updated reentry plan to include universal masking for all students and staff.
Does it need to include with the later coming in later with the, if it goes to y'all or whatever,
I think,
covered.
I mean, I think we can just,
Indoors.
yes.
Do it indoors.
Debbie, did you still want to second that? Yes. All right, questions and comments on that?
I just asked that we do a roll call vote on this, just because I don't want to answer questions about this. So
Any other questions? Comments? Okay. Roll call vote. I vote yay.
Yes.
Yes.
no,
Motion passes 4-1. Item 4A, student learning services. Need a motion to consider approval. Since I started that one, I'll make that one. Consider approval of fiscal year 22 emergency provisional certification for teachers and substitute teachers.
I'll second.
On this one, any questions, comments, information?
Something we do every year, it's just to make sure that we can, like, what Ms. Morgan was talking about, just making sure we can get those provisional emergency certification, that we can get teachers in classrooms in front of kiddos as quick as possible.
Any other questions? All in favor? Aye. Item 5 is attract, recruit, and retain staff discussion.
Wanted to bring this to the board's attention to find out how you wanted us to move forward with this. I know that we had the beginnings of a good discussion with our transportation committee, and that's going to be on the board agenda for you all to update the board on all across the board. Several items to look at, and we're going to work on making that a better situation, a pleasant trip for the kiddos and a good work environment for the staff. But one thing that came up that we knew would come up, and that was pay. And Ms. Downs and Mr. Lee made it clear that that was a staffing, that was a board issue. And so my question is, I've had some other classified and even some certified folks come to me about pay. And I did not know when that was going to be something that you wanted to put on the board agenda. I didn't know if that would be a separate work session altogether, but I thought tonight would be a good time to kind of, come up with a plan on how we wanted to address those things, with keeping in mind our first payroll for our 10-month employees is August the 31st. And so that's really important, because that's when, for those 10-month employees, that first check hits the bank. And so in the event that the board is thinking about doing something different, in addition to or not, we need to plan a date accordingly. Does that do you understand what I'm saying? I don't think that. So anyway, I just wanted to throw that out there, and I've got a couple other things I want to throw out, but I want to start with that one.
And also, the working budget in September, so the change for me to reflect in that working budget.
So on this front, I think looking at pay, because we of course have talked to the transportation staff about their pay concerns. I think additional concerns have been voiced from our cafeteria staff, and they have spoken in support of other classified staff. So I think this conversation is bigger than tacking it onto an existing work session or an existing board meeting. So I would kind of advocate for a standalone work session to talk about the salary schedule and if there are additional things that we would like to do for staff. So we'll,
Scott, is there a particular time that payroll would, if we were going to change something, I want to make sure that we give our if that's a big deal, we're all motivated to help kids, but
We got people to do it.
yes, we need the people to do it. And, we want to give time, for that. And so just looking at the calendar with that August 31st, and we're already in the second week of August.
And we gotta get to the bank prior to the 31st, it's midnight, so.
Yes.
It would probably need to be done sometime for the 20th, or the 23rd, the 27th would be
any changes to be made in the system, and the payroll can be complete and ready for the bank on 30th or 31st.
Is that next week, would there be a day that you can maybe look at on your own calendar to see where
I'm free by any time.
16th, and, I'm not showing the 18th, anything, so 16th or 18th.
If we can, whatever date works probably the earliest, the more time we can allow, the better off we will be. So I guess the earliest date that works for long, much appreciated.
Yeah, I think either the 16th or the 18th will work for me. 16th.
I'll be calling you.
So we will,
So a week from today.
yeah, so let's put it down in like a reasonable pin, just in case any issues crop up for anybody. A work session to discuss the salary schedule on August 16th at 5:30.
All right.
And that work session would need to include Scott, of course, potentially Mr. Brady,
Okay.
you, Tim, if you could record, and Kim, and then if any of you other lovely people would like to attend, just because we're just that fun, you can come too.
Is 5:30 still a good time? 6:30 better, whatever time works best for you all. And sometimes I just, one thing I want you to think about is, as we begin talking about this, it's been brought to my attention that we currently contract with court for athletic training services. And so that's just a contract. And what we're finding is that they are shorthanded like everyone else in the world. And what's happening is that means that our trainer is being pulled over to other schools to supervise their sports, which means our kids in the event sometimes may not have a trainer. And so I just want to throw out an option. There are school districts that have their own athletic trainer and they provide services and they would be our employee. So instead of just supervising high school athletics, we could also do middle school. We could also ask that person to teach some sports medicine classes at our ATC, which we've talked about that with Christina. I've not brought that to the board, so that's an option, and also a possibility of our athletic trainer helping us cover classes in the event that we're short of sub, maybe somebody has to leave a half a day or something like that. Now, that would mean if that was something that we had to do, it would be just like normal. We've never had that person on staff. But, you know, we would have to have a job description. What would that look like? We would have to establish a position and then look at a salary. Typically, a trainer is going to have a bachelor's degree and a master's degree. They're going to have some specialized training, very similar to what our staff do. And so I just want to throw that out because with what we're dealing with COVID and different things like that, we just want to keep our kids safe and we want to offer more opportunities. I didn't want to start down that road if that was not something that the board wished to explore. I can pull some different job descriptions out from some other districts and talk to them and show you some things if that would be something that you'd like to discuss. If you all got questions, if there's other things you want me to explore, I would be glad to do that. Our trainer is concerned that she's going to be away and something's going to happen with one of our kids. She's just concerned.
Like, so what, you know, what we currently like what the value of that contract is now?
Oh, right now, that we're paying, I think right now around $20,000 a year. So
And we get them basically just like on game days, or is it like so much time
Well,
practices, or how's that work?
right, well, what she wants to do is she wants to be there for practices. She wants to be on this campus. So we could have a volleyball game going on, football practice going on, and a soccer game. So she's here. Or we may just have practices going on and she's trying to monitor. And, you know, they do a great job. When we were dealing with COVID, she was helping with that monitoring, making sure they were in their cohorts and different things like that. What she's concerned about is that there may be times that she is told by her contract that she would go to Bardstown to cover a game or go to Thomas Nelson to cover a game because she's been told they're shorthanded. So there could be events that we have here that we don't have a trainer. And so that, the last thing I want to do for you all is that if we have a sporting event going on, we're supposed to have a trainer, and something happens and they call you and they say, I don't understand, my child got hurt, where was the trainer? Well, the contractor tells the trainer where to be and when to be there.
Or the contractor, they just happen to be here.
Right.
So something a few things I'd be interested in.
Okay.
Salary,
Okay.
also, how would the work be? Because you was talking about them teaching classes as well,
Mhm.
but if they're gonna be here all day at school and then be here all evening, they're gonna amass a lot of hours. So, is it something, is it strictly a salary position? Is it
I
a
would,
time,
right.
how would that look?
What I would recommend is that it would be a salary position. And then I would also say that as far as teaching, I would say you're gonna look at, that's gonna be a specialty course. And you're gonna have students that take a sports medicine class who've already gone through like a pretty clear pathway. So you're probably looking at 1 or 2 classes a year, not a full schedule. Because it would be ridiculous to say, you're gonna teach 5 or 6 classes and then be here all night long. But that's something we would have to work out. I mean, we would have to work on our job description, like what would that look like?
Because I would like to see, if we did the job description, I would love to see that if you're gonna take that class, that some of that would be like an internship, that you would go with that individual. So you may have classes so many times and you would go actually with the trainer. Yes, because then you're really gonna get to understand the whole process. And I just know there's a lot of liability issue when we do not have someone there covering for the children. I would like to see the job description and kind of what some of the other districts are doing and the pay scale and stuff, where I know we'd start off with, probably know your experience, or I don't know, depending on what you've been doing, but I would be interested in that.
It was just, for me, unless I know that something's going on or not going on, I can't address that. And once it was brought to my attention, then I felt like it's something that needed to be brought to your attention about, like, what's our options.
And she would fill out paperwork, like accident reports, and she'd fill out, like, set up maybe some sessions with them to help or refer them on, or.
So would she be working directly with nurses and other school employees that are with other kids as well, or would it just be for sports?
It would be for, I can find out what other people do, but I guess my first training thought was it would be like for sports, but then if there's something that's going on at, a practice, she can always refer them to our nurses, and we do that in physician's assistants. So I'm sure we would work through that referral process as well. That's great if we have a nurse. And again, I'd love to see what other districts do who hire them outright. Some districts hire their own nurses. We don't do that. We've got a great contract with Cumberland Family Health. Other districts even hire out their own school resource officers. We have a great, they're always here. They're not pulling my school resource officers away from me. And so, but if they were to start pulling, when we start not getting the coverage we need, I'm going to come to you and say, I just want you to understand in the event someone in the community asks you, why aren't they there? You know what I'm saying? And so, I think it's got some good options out there. I really do, especially right now, our middle school sports aren't covered. Now, she's a great trainer. And if they need something, she's going to go. But wouldn't it be nice for us to be able to say, we've got middle school soccer going on down here in the spring, that she's covering that, as well as, we could have a baseball, softball, and middle school soccer. And she's traveling between the 3, checking on me. So, just another opportunity. Okay, to explore that. And then the last question I have is that we've got a current job description on the books, and it's for our payroll, and we require a bachelor's degree. However, our salary schedule does not match up with what a bachelor's degree salary looks like. And if it is okay with the board, I would like to bring the salary schedule back to you all on Thursday to match the job description with the salary. Okay. Now, I guess my last question is in regards to this work session. Has this been what you all expected it to be? And is there something that I can do different for you all to make it more productive?
I think we hit on it a little bit earlier. We would like to, I know the next meeting is not going to be the fullest meeting. So we wouldn't have as much to talk about, but I would, if there was anything else coming up on Thursday, be sure that we include it in this meeting.
Well, I think, so that was kind of my thinking on this point is because we are now at 2 hours on our work session. And we are probably looking at an additional 2 hours on Thursday. So my kind of thinking for these work sessions is that we would look to stick into 3 to 5 items for discussion. And it's the biggies, the big ones that there are a lot of questions, there's a lot of information, that we would eliminate any action items. So I understand we've got 2 on there tonight, and specifically because we are starting school on Wednesday, our board meeting is on Thursday. So going forward on the work sessions, I would hope to just not have any action items on our work sessions. I would like us to stick to an hour on our work sessions because it really is an opportunity for us to gather information. So I think it's important for us to still have these discussions that we're having. But I think we can gather information, we can ask the questions, we can confirm with the staff, this is what I need before Thursday to prep for Thursday. And then these bulk discussions really happen at the board meeting. Because again, what we want to avoid with the public is that, okay, well, it's a lot of meetings, and which ones do I watch and which ones do I pay attention to? And historically for our district and our board, work sessions have truly just been information gathering conversations. And so for these, that's what I would like to see. I appreciate that. We need to ask these questions. We need to communicate with the staff on here is exactly what I need in order to prepare for meetings. But I know that from a family perspective, I know that my children are getting into bed right now. And if we can avoid us missing bedtimes or dinner times or baseball games 2 nights a week in the same month, then I think that's what we should shoot for. So that's kind of my thinking on these work sessions, is that they are limited to an hour, 3 to 5 items for discussion. And if it's 5 items, then it's 5 medium-sized items, not 5 big fat rocks. It's kind of my thinking. And again, we can still have good, solid conversation at our board meeting, but this is really just a way for us to ask questions in preparation for that meeting.
Is 6:30 going to be the whole time, or was that just?
I think it's just a day.
I agree with that. It'd be a chance for us to be able to ask the questions, get them to the proper channels. I don't know that everybody has to be,
Right, and that's
for
part
you
of it. I
guys,
think.
yeah.
Yeah, I think there's some additional joiners today. So, part of my preparation for it is saying, okay, well, this is, this area that we're talking about, like for the salary schedule work session, it's Scott, it's Mr. Brady because he's HR. It's identifying these specific staff people who really do need to be here to weigh in to answer questions, and then allowing the rest of the staff, although we love seeing you guys, to not be here if you don't want to be here.
Right.
And so we're being very mindful of who we're asking to be here and who, it's not that we want to exclude anybody, but it's also trying to understand that 2 marathon meetings in a week is in my opinion, too much. Yeah, I love you guys, but I love my kiddos more. Sorry. So that's kind of my thinking on the work sessions is what we'll shoot for going forward.
There may be some months that may not be more.
Yeah,
I was going to say, in that case, is it something we can cancel and just say?
absolutely.
If it's not going to?
So, and on that front too, we've got kind of dates that are tentatively selected for our board meeting preparation work sessions throughout the remainder of the year. In December, we have to approve our calendar for next year. So if we find that these work sessions are helpful, they are beneficial, they are something that we want to continue forevermore, then we will need to approve them as part of our board meeting schedule for 2022. And that's something that we could absolutely cancel and explain to the public why we would cancel it, because for whatever reason. But yeah, we can alter our schedule, but that's the one thing that if we do want to make these a regular part of our calendar, we would need to add them to our approved calendar in December.
I just would like to say we've put a track record and retain staff discussion that I would like us to revisit, not right now. We need to get through the first of school, but maybe in September, October, really take a good hard look at some strategies and working with specific staffs and committee and hit that strong.
But for the 16th, it's gonna be specifically in regards to
Salary
salary schedule.
That's it.
Yes.
Okay, all right.
Yes.
And if there's things, if there are specific items that you want me to bring, obviously numbers are gonna be the big thing. I will try to have those numbers and we'll be prepared to share those numbers with you. Like for instance, our cafeteria staff, if there were things we were doing specifically for them, that's a different fund than our general fund. So as we calculate numbers, we can show what's coming out of the general fund, what's coming out of Fund 51, okay? That sound okay? All righty.
Thank you for the shirt.
You're welcome. We'll begin to, we'll study the book together and, when we show up, we want to let everybody know we're from Marion. Appreciate you all.
Other questions or comments? I need a motion on item 6.
Second.
All in favor?
Aye.
Aye. Thanks, guys.
Oh.
That is the medium.